So my topic is congestive heart failure, or commonly known as CHF. So you may be wondering, what exactly is congestive heart failure? Well, congestive heart failure is when your heart doesn't pump blood like it should, which means that if your heart doesn't have enough blood, then your organs could potentially not work as well as they should, and there could be a bunch of really serious problems resulting from that. You may also be wondering, what is the leading cause for congestive heart failure? Well, the leading cause for congestive heart failure is something called coronary artery disease. Coronary artery disease is when there's a buildup of plaque, which then leads to the blood flow not being able to reach the heart properly. You may also be wondering, what tissues and organs does it exactly affect? Well, congestive heart failure affects the lungs, lower body, liver, and the abdomen. When blood doesn't pump like it's supposed to, it'll then cause a buildup of fluid in the body, which will lead to a bunch of issues and problems. Treatments. So there isn't a cure for congestive heart failure, unfortunately, but there are treatments that will help with it, which includes eating less salty foods, in some cases using a defibrillator or a pacemaker. Those two may help. Taking medication prescribed by a doctor, or coronary artery bypass surgery. These are just a few of the treatments that will help with congestive heart failure. So you may be wondering, what are the signs and symptoms of it? Well, the signs and symptoms include shortness of breath, fatigue, swollen legs or feet, fast heartbeat, pain in chest, weight gain, or dry cough. So you don't have to have all of these symptoms, but you do have to have a few in order to have congestive heart failure, or CHF. So how common is it, and / life expectancy? So according to clevelandclinic.org, a little bit more than 6 million people in the United States are diagnosed with congestive heart failure, or CHF. The life expectancy for someone that has congestive heart failure is approximately 5 years. Now, I don't really think it's 5 years. It's not always 5 years. It can be a little bit more than 5 years, or much more than 5 years. My grandmother, she has congestive heart failure, and she's had it for 15 plus years. So it can definitely range depending on the person, what kind of symptoms they have. And so here are my 5 questions. I'm gonna run through them really quickly. So number 1, what is congestive heart failure? A condition when the heart doesn't pump blood like it's supposed to. B, when the heart stops pumping blood. C, when the heart slows down. Or D, a condition when the heart forms blood clots. So for number 1, the answer will be a condition when the heart doesn't pump blood like it's supposed to. Number 2, what is a cure for congestive heart failure? A, surgery. B, medication. C, there isn't a cure, but there are treatments. Or D, exercise. So for this answer, it'll be C, there isn't a cure, but there are treatments. Number 3, is congestive heart failure hereditary? A, no, it can't be hereditary. B, there's no such thing as being hereditary. C, yes, it can be passed down from generation to generation. Or D, yes, but only sometimes. For number 3, the answer will be C, yes, it can be passed down from generation to generation. Number 4, What are some signs and symptoms of congestive heart failure? A. Dizziness, sore throat, poor vision. B. Shortness of breath, fatigue, irregular heartbeat. C. Swollen ankles, legs, and feet, cough, fast breathing. Or D. B and C. So for this answer, it'll be D, B and C, which is shortness of breath, fatigue, irregular heartbeat, swollen ankles, legs, feet, and cough and fast breathing. So number 5, how severe is congestive heart failure? Exactly. A, life-threatening. B, it is very serious. C, which is A and B. Or D, which is mild. So the answer for number 5 will be C, A and B. And A is life-threatening, and B is it is very serious. So these are just all of my 5 questions, and these are just a few of my references that I use for some of my information.